I'm Kieran Anderson, group publisher here at Applied Radiology. We're here at RSNA live with Dr. Suzie Bash, a neuroradiologist and a medical director at RadNet, and also the chief medical officer at Cortex AI. Welcome, Dr. Bash.
Thank you, Kieran, for having us.
I'm joined by Kyle Frye, who is the CEO of Cortex AI, and we're really happy to have you both in the booth. Kyle?
It's an honor to be here. Yeah, we appreciate the opportunity.
Thank you so much. You know, we're here to talk about NeuroQuant and how you're using it in MS, right? And you know, let's just get started. What is NeuroQuant MS, and how does it add clinical value to you as a neuroradiologist, Dr. Bash?
Yeah, so NeuroQuant MS, in addition to calculating the volumes of different substructures of the brain, it actually calculates the volume and the counts of lesions within the brain, so MS plaques. And so what it does is it will identify plaques, and then it will color code and segment them according to location. So periventricular, deep white matter, juxtacortical, and infratentorial. And then, very importantly, it will incorporate the prior study. So MS patients tend to get scanned once a year. It will incorporate the prior study, and it will calculate lesion dynamic change over time. So it will tell you the number of plaques that are increasing in size and number, and what's new, and what's shrinking, and what's staying stable. And it turns out that this is an extremely useful tool, because if a patient only has, a few plaques in the brain, it's very easy visually to see what's different from the prior study. But if they have a moderate or severe plaque burden, which most MS patients do over time, it becomes very difficult because of differences in slice sampling and head angulation. But computers are very good are much better than humans at pattern recognition, although humans are better at global reasoning. But because they're better at pattern recognition, it gives a very accurate picture of what the patient's at. And that information will help inform decisions on changes in disease-modifying therapy. So if the patient had 4 milliliters of plaque last year and then come back and they have 6.5 milliliters now, that neurologist will likely change their medication. And there's great disease-modifying therapy out there. So if you ask our referring neurologist what quant tool is probably the most important, they actually will they'll probably say NeuroQuant MS, because it is just extremely important for managing their patients. So it's a really wonderful technology. I've been using it in my clinical practice for probably about 8 years or so for MS, and there has also been a tremendous difference in the accuracy of the segmentation over time, because now we incorporate deep learning as opposed to just machine learning, and it really helps to identify those subtle plaques that might be infratentorial in location. So we use 2 input sequences, the 3D-T1 for the volumetrics, and a flare sequence, and ideally a 3D flare. And then you can see over time, as you go through the plaques, which plaques are new or enlarging will be red, shrinking plaques will be blue, and everything's laid out there for you in your report.
Oh, it's fascinating. Kyle, Dr. Bash did kind of refer a little bit to what some of, her fellow neuroradiologists are saying, but what are you hearing from, your other customers, the feedback from them on this NeuroQuant for MS?
For us, it's been, a journey with our MS product, right? We've had, different variations, and I believe really we're at the highest level we can achieve here with MS, which is we're being used daily by major institutions across the globe that have now adopted what our MS product does. And a lot of that is adding in the AI, the machine learning capabilities there, really enhancing our algorithms, but really listening to our customer base, right? Suzie was very instrumental. We have other key neuroradiologists and neurologists that were instrumental, to the point that we've received from looking at neurologists across the US, have received raving reviews of our technology because of that longitudinal capability, and actually feeling very comfortable in the data that they're getting, that it's specific, that it's reproducible, and that it hits on those points. And that's a big deal, right? If you don't have data that you can trust, it's not going to do any good in your treatments. And so that's the beauty, is we have thousands and thousands of cases that we've utilized within our AI, machine learning, our deep learning there, to be able to come out with, we believe, is the best-in-class product. And the customers that we are serving today are loving it and asking for it. And for us, it's really to maintain that we stay on the top, that we are adding in additional key features that really allow for your life to become easier, right?
Absolutely.
It's about making that workflow easier, making sure when you're seeing those patients coming back that you can feel very comfortable and you can have quick looks. You don't need to add that additional time. Let's make the lives easier, not only for the patient, the radiologist, and as well as the neurologist.
It actually makes us better radiologists. So if you don't use quantitative software, like one study showed that in general, our neuroradiologists would say there's 24% disease activity, meaning new or enlarging plaques. If you use quantitative software, that percentage actually jumps up to 74%. So that makes all the difference to the neurologist. Radiologists tend to be paid on an RVU basis, so we go faster and faster. And so you'll tend to see people will say stable, stable, stable for each exam over the years. But when in reality, when you really look at the quantitative volume of plaques, it really may be going up. And again, a huge difference. And not only that, but it improves our intra-reader and inter-reader variability by 22 to 23%. So it's really allowing us to provide a more accurate report, which is extremely important. And I can tell you that's exactly what our referring neurologists want.
Oh, I believe it. I believe it. You know, Kyle mentioned something earlier on about like time savings and just giving you guys more time. How much time are you getting back using NeuroQuant for MS?
Well, that's an excellent point. It really does impact efficiency in a positive way. So you can save, on average, about 38% of time when you use quantitative post-processing for these MS patients. So in one study, a neuroradiologist was able to read about 13 cases an hour for an MS when they use the quantitative post-processing software with a pre-populating reporting template. That's an automated generated summary of the findings in the report. So when they use that, they could go 38% faster, whereas they were able to read 8 studies an hour without the software. So again, that's something that is highly appealing for neuroradiologists, where we're all trying to save some time during the day and be able to trust the software. And again, with the advent of deep learning, it's been it really has increased the accuracy of the segmentation. So an extremely useful product.
Kyle, as you think about like kind of going forward here now with this NeuroQuant product, and really these quantitative MRI tools in general, like NeuroQuant for MS, do you feel like these are going to become the standard of care? Dr. Bash kind of referred to that, but there's still a way to go as you think about this standard of care going forward into the future with sort of longitudinal evaluation for all patients, really, especially those with MS. What are your thoughts?
It absolutely will be, and it truly has to be, right? Because neuroradiologists are, leaving, going different places, changing different organizations. And what do you have? What is everybody talking about is data, right? Data is everything, right? So just having those black and white images aren't going to be the same as having those reports to actually track and look at that patient. And if a patient, moves and goes somewhere else, what is happening there? They can actually bring and have that data, with them, right? And so it really will, it needs to be. I believe it truly will be the standard of care over time. And we're evolving with that, right? We're adding in, our MVID report, right, that can look at, the vascular side, that can look at Physicus scoring. We're adding in, different reports along the way that continue to allow to look at these, life-altering disease states in the brain. And so we're, with our same sort of makeup and scanning and sequencing and protocols, we're able to add in and layer in reports that no one else can offer. And it really helps make a difference, not only in what you're doing, but for us, our mission and vision is how do we make sure that we're impacting patients' lives at a greater level each and every day. And that's your oath, right, is to do the same. And so we want to be able to help do that.
Right, absolutely. And it also, it turns out that we are really not that great at measurements, and a lot of it isn't our fault. Patients come in and their head is angled at a different, location. I can't even tell you the number of times where I'm like, oh, that plaque is increasing. And then I see it in a different plane. I'm like, oh, that was actually, we just sliced it through differently. It's not changed or whatever. And so again, the volumetric software really makes it a much more accurate report. And I 100% believe that this I believe it's transitioning into standard of care. And really, people that aren't using it probably just don't understand the value yet, just haven't learned that the software is available. But you know, our neurologists, they for at least in the area where I live in Los Angeles, they order it every single time on every single MS patient. And actually, if there was some problem and we didn't do the correct input sequence, they'll actually have the patient come back. That's how much they care about it.
Well, I tell you what, I mean, I think that this was a fascinating conversation. There's so much to learn about, you know, NeuroQuant for MS, and really these types of these new products really that you're bringing to market, and the difference they're making every day in your lives, but also patients' lives. So Kyle and Dr. Bash, thank you again for taking the time to sit with us here at Applied Radiology and talk about NeuroQuant for MS.
Thank you for
Cam.
having us.
Appreciate it.